And Arizona is in the national spotlight this week with key races that could have ripple effects across the country.
Former President Barack Obama will visit the valley for a rally this Wednesday. Mr. Obama says that democracy is at stake in this election. He's backing Democratic gubernatorial candidate Katie Hobbs and incumbent Democrat Senator Mark Kelly.
We're 8 days away from the midterms, and issues from health care costs to fentanyl are important issues on both sides. But do voters impacted by those issues really believe the answers are on the ballot?
Team 12's Michael Dowdness sat down with a man sharing his headaches over his medical bills.
You know, you keep hearing about this candidate's going to lower prescription costs, or this candidate's going to have a better healthcare system. I think they're going to say or do whatever they can to get elected.
Bruce Nestor has seen the ads, the speeches, but he's also experienced the system.
Hasn't been the best.
In October of 2020, Bruce went to the ER at Banner Health. He got an x-ray, some blood work, but after a nurse mistakenly tried to wheel him into a surgery he was not signed up for, he decided he would be safer at home. Months later, the hospital billed him and his insurance $12,000, including $4,500 for intensive care, room and board he never received.
You know, it could be the difference of not making your mortgage payment.
After our story first aired last year, Banner stopped asking for more money. But since then, he's seen other issues, from different charges for the same service,
You know, where things don't get processed correctly.
to learning his wife is no longer qualified for drugs she has had for years.
Work fine, and all of a sudden now that you don't meet the criteria. Well, what's the criteria? Is it just cost too much?
To Bruce, it's more than just the drug prices or the broad changes to healthcare, but addressing a system that's become too complex, too inconsistent, too difficult.
I don't hear anybody really talking about how to simplify it. And that's my major concern, is like, look, you know, if I'm having these issues, I'm sure other people are.
Ideally, Bruce wants someone to create a more straightforward system where folks who have disagreements can have a third party quickly resolve problems. And while politicians talk about changes, Bruce doesn't believe the healthcare solutions are genuinely on this year's ballot.
And I don't think a lot of it will ever transpire. I think we're going to continue with what we have. Unfortunate.
Michael Dowdness, 12 News.